Hello, MAs. Welcome to Injections. It's time to give it your best shot. Some of you may have noted I've changed that title from the slides on Canvas already. We're talking about giving shots. Of course, we'll be taking some shots as well, because in lab it's going to be a back and forth. But in this lecture, we're going to be discussing the finer arts of how we're going to prepare to give that injection. And those are the skills that we'll be talking about. So there are really two major components when we talk about administration of injections, administration of medication via needles. There's the skill set, and we're going to be working on that directly in lab. How to load a syringe, how to assemble it, how to fill it, make sure everything is exactly as it should, how to treat the area where we're about to administer that injection on a patient. But there's also an art to it, and the art is really how you control the environment around giving this and performing this injection. There's always, well, I shouldn't say always, there's often anxiety involved with the administration of injections, usually from the patient, sometimes from the person who's giving the injection if they don't have a lot of experience. And as we move through the semester, as you're giving and receiving injections from each other in class, I really want you to focus on your feelings and how you feel about giving that injection and how you feel about getting it. And how do you feel about it as the patient if the person who's giving it to you seems to be nervous or not quite settled about what they're doing? And if you start examining your own behavior and feelings around these things, you'll start to assemble a skill set. And this is under the heading art, of course, the art of how to give an injection. You'll start assembling information on how you want to approach it as an MA. What kind of things might you say to make a patient feel more confident, less nervous? How do you make yourself less nervous when you're performing the injection and you have to give it? Believe me, there will be some nerves involved. There certainly were for me my first several injections as I started, but the more I had done, the better I got at it, and the smoother I got at it, and the more adept I became at making patients feel comfortable about it. So that's part of what we're trying to develop here as well this semester. All this comes into the category of knowledge, rapport, and with the patient and the family is very important. Effective communication, always effective communication in what we're doing. We're dealing with a very personal thing for most patients, and that's their health care, or the health care of a loved one, or their child, or their grandmother. And so communication is really at the hub of what we need to provide for our patients, especially in clinical settings, but also in administrative settings. We're going to try to provide some comfort, of course, work safely, and we're going to document. I'll say it again, and I know you heard it before. If you didn't document it, it didn't happen. And that falls under the legal aspect of what we're doing. So you probably already know the relationship you have to the physician, that you work under their license. You probably already know, and in case you don't, I'll inform you now, that any injection you're going to administer is going to be under direct order of a physician or a PA or a nurse practitioner, someone with a medical license. And so you're going to have that order, and that order has to be an official order before you can proceed as a medical assistant and perform that injection. Competency has to be assured by the physician, and mistakes must be reported to the physician. Of course, we want to minimize them, but human error does happen. So if you make a mistake, you have to own it. Integrity in medicine, as you all well know, is very, very important. And it's a topic that's very near and dear to me. I believe that we have to have absolute trust in the people who are performing medical procedures on us, that they have our best interest at heart. And if they don't, that jeopardizes everyone, and including our own safety or the safety of our loved ones. So we have to have that integrity. Everyone's going to make a mistake. Make sure you report it to a physician so that you can get the situation back on track. There are many reasons for giving injections. You see many listed here. I'm not going to run them all down. I do want to call out a few of them. I see insulin here on the list. Anticoagulants is on the list as blood thinners, and epinephrine, and that's to treat anaphylaxis, which is a potentially deadly allergic reaction to a foreign body. So it's an overreaction by the body to an allergen, in other words. Those three things I have never had a direct order from a physician to administer. When it comes to insulin, blood thinners, and epinephrine, I've always seen those administered by doctors. I have had orders from doctors to show patients how to administer insulin on themselves, so I've done demonstrations. But as far as actually administering insulin, once again, I've seen doctors do it. As an MA, in my 15 years as MA, I was never asked to do it once. Epinephrine is usually an emergency, so if that's going on, the physician's attending, they're most likely going to give that injection. And anticoagulants, you know, when you're messing with blood thinners, all kinds of things might go wrong, and a small error can end up in a big mistake. And that's true with any of these things, but especially when it comes to these three that I'm talking about, and anticoagulants, of course, included. So those are things that generally physicians will do. You may get the order, so be familiar with it and be familiar with the protocol. Just be aware that it's not the most likely. These other ones that are listed here, especially when it comes to immunizations, are definitely in our wheelhouse, and you will be called on to do that if you're working in a clinical environment. So some terminology we want to review. You know, we start with the term, I'm actually going to flip these two around. I'm going to start with pathogen because that's the root here. This is a disease-producing microorganism. And if we do the pertaining to, we add ic on the end of it, the IC, we get pathogenic. It means it's capable of causing disease. One step further, a bloodborne pathogen is, this is a microorganism that's going to be transferred via blood. So hepatitis B, hepatitis C, HIV, these are the big ones. And as you heard me say in lab, and I think I emphasized it, but let me just repeat it here. The Hep B immunization is something you can protect yourself from, or I should say hepatitis B is something you can protect yourself from. You need to be immunized in order to go into a clinical environment. It will be required for your externship. So if you haven't started that series, get it started now. You can't really do last-minute Hep B immunizations. They have to be done a certain amount of time before they're needed. So really, I would try to do it by the end of September at the very latest. And asepsis is a general term meaning free from infection or pathogens. So just to clarify, the equipment that you'll use, the syringe, the needle, the medication in the vial, all of those products are sterile. And when you open them, as soon as you open them, they're not officially sterile anymore, but as long as you don't contaminate them, they still retain their sterility. That's different from asepsis, because asepsis is not sterile. Asepsis is more referring to where we're going to perform the injection on the patient, so what body region it's in. And if we use aseptic technique, we're using something like an alcohol swab to swab the area. And we're trying to remove all the pathogens that we possibly can with that technique. You know, it's defined as free from infection or pathogens. And generally speaking, it is. There are some minor exceptions to that. So asepsis, when we talk about that, we're talking about cleaning that area where we're about to perform and administer the injection that we're talking about. We have medical asepsis, so we notch it up one more level. These are practices used to reduce the number and to lower the transmission of pathogens. Hand hygiene, we've used a sanitizer in class. We'll also be doing lots of hand washing this semester, so we'll talk about those techniques. Antiseptic, these are agents applied to body tissue that kill disease-producing organisms. And parenteral, I mispronounced that entirely. Parenteral. This is a route. This is a route that we use to administer medication. It's a route that's taken into the body through piercing of the skin or mucous membranes. In other words, it's any other route besides oral, nasal, or rectal. And there's a few additional routes on top of that that we won't get into because we're not working with IVs in this class. But this word describes those alternate routes other than nasal, oral, and rectal. Contaminated. Presence of blood or other potentially infectious materials on an item or surface. Can you always see contamination on a surface? If you said no, you're correct. So, aseptic versus sterile technique, either one, depending on what we're cleaning, is required to reduce contamination, or ideally, in the case of sterility, to eliminate contamination. So if we have any blood or any potentially infectious material on an item or surface, it is contaminated. A safer medical device, we worked with this a little bit in class when you had to set the safeties for us before you drop the syringe into the sharps container. These are devices that make an exposure incident involving a contaminated sharp less likely. So they're trying to make the environment safer. PPE, before COVID, not everybody knew what this meant. After COVID, or during COVID, I should say, because we're still in it, we know it means personal protective equipment. I think by this point, you're probably very familiar with that, so I won't review it. However, we will talk about it in class. So if you're vague on it and you're not quite sure what PPE is or what it consists of, you can always bring it up in lab and be happy to review it with you. Some more terms. We have occupational exposure, which in essence means that you got exposure to a bloodborne pathogen or another form of pathogen as a result of a procedure you're performing. So here it gives a more definite definition, I guess, for lack of a better term. A more precise definition, I guess, is what I mean to say. But that's essentially what it is. So it might be urine, it might be plasma, it might be feces. It's very likely to be blood if there's any exposure at all. And that's, once again, involved with the occupation or in the act of doing something. We're going to call that occupational exposure. An exposure incident is kind of the same thing. It's just we're talking about the fact that it happened and what happened. I guess the best way to say it, what are the circumstances surrounding this occupational exposure? How did this come about? And by the way, this picture here is a really, really interesting view. I didn't make these slides, so I'm seeing some of these pictures for the first time. That is a really severe occupational exposure. There's a lot of blood there. In fact, you know, with most occupational exposures dealing with sharps, there isn't a whole lot of blood involved. Most of those are needles that get out of control or get set in the wrong direction, end up breaking the skin of the person who's performing the procedure or assisting, or in some cases of the patient themselves. And it's usually pretty minor when you see it happen. The result of it can be huge, but there are times when you'll see it happen. I've seen occupational exposures that were very random and very slight, and potentially could end up in a huge disease state. So all these things I've just discussed, they kind of fall under the category of these two words here. I'm going to pause this right now. We're going to start with our bloodborne pathogen in the next segment. Just so you know, my lectures are broken into about 10 to 15 minute segments, which gives you a little bit better way of absorbing the material. So I'll pause it here. In part 2, we're going to pick up with the OSHA standards.